Have you ever thought of what it means to be an active patient? Dr. Marjorie Dixon, our women's health. So that's what this is all about. And what do you mean by being active? What should we be doing?
Right. So I don't mean being active. It's good to be active.
Yes.
But this is being an active patient because I find sometimes when people are preparing, for example, for a procedure or an intervention, or they're going for day surgery, they come to the office for their preoperative appointment or for their consenting appointment, and they don't hear anything.
Right.
And so when they get to the surgery, they miss very critical parts, or the intervention, they miss critical parts in the preparation and for the execution of a healthy, safely done procedure. So one of the things I say to my patients, I get two kinds of patients. I get the patients that when I say, okay, so you're going to be having your procedure on this day, here are the benefits and risks. And I have some patients who go like, what? Blank, like I'm Charlie Brown, the wah, 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 wah. So I say all this information, and nobody gets anything. And then I have the analytical patient that has like 16 pages of notes on their iPhone, and they're like, okay, so wait, what about this? And they get lost in the details that don't matter. So this is going to be kind of like a cheat sheet to the things that you need to have, and then what you should bring with you. So the first thing you should bring with you is a support person.
Yes.
Another set of eyes and ears to actually listen to what the doctor says. Because when you consent someone for a procedure or whatever, you say, okay, here are the benefits and risks, and here are the non-interventional or non-surgical options. And sometimes people don't hear them, and then when you meet them on the day of, they say, well, you never told me the risk is that. So your physician or your medical practitioner will say, this is the benefit, this is the purpose of the procedure, this is who's going to be doing it, because in a teaching institution, it's not, I do the surgery, but there may be other doctors who are assisting, so you might meet a whole slew of people when you get there. Someone asking for your medical history, somebody else, the anesthesiologist bringing you into the room. So people need to know, because for me, when I have a surgical day, I mean, I have a playlist on my iPhone, I'm chill, I'm smiling, I'm happy, because this is what I do every day, it's normal. But for patients where you feel like you're going to do something and you worry, sometimes you miss the important things.
Absolutely. And also when you're sitting in that chair and you've just heard, you know, that surgery might be on the table for you, it's a lot of information coming at you. I remember being in the hospital with my daughter, and I was the patient that went blank. So it was good to have Leo there to sort of take in the information. So is it okay if you're one of those patients that keeps saying, could you explain that again? Can you explain that in layman's terms? Is this what you mean? Like, that's okay.
Exactly when you say, is this what you mean? I bring it to the level where I feel that my audience will understand it.
You're good at that.
And then I will say, why don't you tell me what you think I just said to be clear that you understand me? Tell me what I just said. So you learn to communicate with your patients. But having that extra set of ears is critical. The other thing you should do is bring a pen and paper. Write down what we're saying. So we have it down to a bit of an art in my office. We give patients instruction sheets for the different procedures that they're going on, things that they can read before. As I know I told you all this in the office. I dictated a note that I told you all this. I had you consent and sign off on the consent, but you might not remember. So here's some literature to take with you about the procedure and what you need to do in preparation.
I love it. You're my kind of doctor.
You know.
I want it all written down. I want a list. I want everything. I want to read it the night before. I want to read it the week before. I want to make sure that I'm on top of it. But not all doctors are as good at communicating and bringing it down to a level. I mean, what if English is your second language? What if
bring a translator?
Bring a translator.
So these are what I mean. Like if you know that you have trouble understanding English and your doctor's English, bring someone who's a perfect translator of yours so that they can be your advocate. When you come for your procedure, I also say, don't say you're going to drive yourself.
No.
Don't say I'm going to take a taxi. Actual medical facilities have a responsibility to their patients. So I don't let anybody leave in a cab.
No taxi?
Well, if you have a support person, what happens if you faint in the taxi after? You think Mr. Uber driver, no offense to Uber taxi, but they can't be held responsible. We're accountable. So we tell you what the risks are. If you're sedated particularly, you should not be operating heavy machinery or driving or doing anything like that for 24 hours. Yeah, so you can't not have anybody with you.
You need your person.
And actually, once we've given you an anesthetic, I talk to all of my patients after the surgery. Sometimes they ask me, were you there?
Oh, really?
Because there's an amnestic effect to the medication. So it's really important when you bring your support person to the preoperative appointment to ask those questions. What's the purpose of the surgery? What are the benefits and the risks? Where do I have to go? How soon do I have to get there? You also need them after the surgery because I tell you what happened, but you might not remember. I say, can I say everything to your support person? Because I will explain what happened to them so that they can also communicate it to you when you get home when the anesthetic is worn off.
Good information. So you're prepared in the lead up to you're prepared in the post situation.
Yes.
So you've got your person,
Yep.
you've got your way to get home. Is there anything else that a patient needs to do to be an active participant in their health?
Follow the instructions. Because if we say don't eat anything for 24 hours before
Right.
your surgery, it doesn't mean cookies and milk at 2 a.m. because that happens.
Really?
Yeah, so patients wait for surgery time. You
Yeah.
have your date, it's allotted, the hospitals are all teed in for your procedure on that day with that doctor.
Yes.
If you show up and you haven't followed your instructions explicitly and you had something, milk and cookies at 8 a.m., your surgery's at 10, your surgery will get canceled. That slot, that very precious slot for surgery, can't be reallocated to somebody else on short notice.
Right.
So it's lost OR time, and then you get rebooked at the bottom of the list. So make sure that you follow the instructions explicitly, and one of them is any pre-medication, medication you need to have post, how you take those medications. If I'm doing a surgery and someone's bowel might be involved, I bowel prep them, which means the whole day before, they're preparing for the surgical date.
Right.
So they have to take enemas to evacuate the bowels, and they have to do it at certain times. So much as you think that you can remember the minutia,
Yeah.
make notes, have literature, bring a support person. It just reinforces what you can do to have a safe and healthy and successful procedure.
If people don't understand why it's important not to eat, why is it important not to eat before surgery?
Because you can, when you're sedated, you don't protect your respiratory system,
Yeah.
so that if your gut is full, you can throw up into your,
Yes.
and then you aspirate, you suck it into your lungs, which is a whole slew of complications and problems.
So it's serious.
It's a very serious problem. People can end up in the ICU with an aspiration problem. So do not eat before your surgery.
See, when you say that, I don't want the cookies anymore.
Oh, really? Yeah. I'm like,
good to
so when
know.
I said to the patient, I'm like, I hope they were worth it.
Now,
I hope
no
those were
surgery
some
today.
really
It
good
was so
cookies.
good.
Yeah.